Still many people experience that even if I have passion, I can't able to read. I am very bored after reading these huge books and these large topics and all of that. And it's like very factual things more than even conceptual things. So how to remember that? One thing is try to find out concepts in everything. Medical field is like memorizing things. That is one belief, but that is not at all true thing. Medical field is based on purely scientific and conceptual things. If you will see and if you will try to find, you will surely find concepts during each and every disease, process, treatment, everything, and try to integrate all of this. Like if you are reading asthma, then try to start from the what is asthma, why it happened, then visualize everything. Like if one patient came to you with complaint of breathlessness, what you will do is you will first examine your patients. You will put stethoscopes over here and there. You will ask the patients about the history, previous attacks and all of that, and then you will examine the patients again. You will ask for systemic diseases or anything like that. Then you will send him for investigation. What investigation you will do? You will do chest X-ray, CT scan, spirometry, lung function, all of that. And after then when patient will come, you will see, okay, these patients have FeV1 by FVC ratio is more elevated or decreased, and you will diagnose your differential diagnosis. And then you will come to analysis that okay, this patient may have asthma. Then you will ask about the asthma triggering factors, and after all of that you will prescribe the things. What things you will prescribe? You will prescribe one long acting, one short acting, one SOS tablets or whatever. And which tablets are short acting, then you will remember that okay, these two are short acting, these two are long acting, and how to take this via metered dose inhalator or anything. So this is called integration. I integrated pharmacology, medicine, pathology, and every physiology and every related subjects in only single topic. If you are reading asthma from the medicine, try to integrate things from your pharmacology too, like which drugs are given in the asthma, which are the side effects of that drugs, which are the precautions should be taken before giving that drugs. So that is one thing to remember. If you will try to adapt your reading like this, you will definitely remember your things for whole lifetime. I didn't read asthma since 1 year, but still I remember the drugs, the process, the interleukins and all of that, if you will try to ask me. So that is the thing I read it, and I recommend you that it will be very helpful if you read like this. Don't try to be very over enthusiastic for covering all of that, all the subjects simultaneously. Just do basic things, like just remember the drugs names given in the asthma and all of that. Otherwise you don't need to be revise whole pharmacology of asthma. It will be revised during your pharmacology revision, but during medicine revision just integrate pharmacology superficially, or pathology or physiology, whatever. Now second thing is how to remember factual things. Factual things you have to remember, you must have to remember. Nobody can crack exam only based on the concepts or only based on the factual thing. Each paper has combination of factual things, one-liners, and concept-based things. So you have to remember the genes, the mutations, the bacterial colonies names or signs or whatever things. That should be remembered. But one thing, how to remember? One thing I already told you, that try to see images of each word and each sign or each factual thing. If you don't find any image related to that, then one thing is try to visualize image. Try to form images in your mind, not from Google. Whatever you will find something. I want to tell you one example. If you are giving me to, as I already gave example, tinea solium and tinea saginata are both very confusing topic. Now how to remember which is long and which is short? So solium has long name. Saginata has long name compared to solium. It has 6 words and it has 8 words. So saginata is long, solium is short. I remember that for my whole life. I never forget that thing now, because that is called the correlation between the practical things and your study material. Then like tinea solium has vector. What is the vector of tinea solium and what is the vector of like host or vector, whatever, of tinea saginata? Tinea sagin. So I remember that by tinea solium, sol means foot. Foot is like very dirty things. So same as pig. Pig is very dirty. They are always live in mud and all that. So I remember that okay, solium has pig and saginata has remained vector cow. I was confused between cow and pig. So I remembered like that. One thing I remembered by that, and other thing will automatically be remembered. So that is the tricks. That are the smart working tricks, and that you should find yourself. I had many things like that. I prepared many factual things with like that, and I will give you. But as of now, you should try to prepare that things by your own self. Apply your knowledge. Apply your like genius brain, and find out something, anything correlated. If you are reading some red word, in that some red will come, like that rancho on the board wrote one word, and there is no meaning of that word, but only one single Raju word has that meaning in that whole word. So that thing is also good thing if you will learn. Like if you are reading one difficult word, then it's not need to remember whole word. Just find out one 3 or 4 letters word from that word and remember that word with that. Like there are so many culture medias for microbiology. In that you can remember via that. Like one is Campylobacter is that. So Campylobacter has Skyros media. One is Campybap media, and other one is, there are 3 medias for Campylobacter. So I don't remember all of 3, but through medias I am just giving you example. So Campylobacter has whenever I remember Campylobacter, I remember sparrow. Sparrow means that bird, and from sparrow I remember Skyro. So whenever I find Campylobacter, I visualize the image of Campylobacter in my mind, that sparrow has Campylobacter in its gut. And so whenever the Campylobacter word will come, I remember sparrow, and from sparrow I easily remember that okay, sparrow or Skyro, like that. In MCQ it will be Skyro only, no sparrow like that. So you will automatically, your mind will find that Skyro word, and you have gut feeling that okay, that is the word for Campylobacter. Another thing is Campybap. So Campy is Campylobacter. Bap, remember that Bap is like Ma Bap. That Campylobacter is the Bap of all bacteria, like that. Whatever, these are very silly things, but that things are important for your preparation, and you will surely remember the things via these methods. You will like sometimes you will feel very entertained while remembering these types of things, but that things are very useful for your preparation. So try to remember like this. Try to do like correlation with your surrounding environment, with your visualization power. Every case visualize every disease visualize as a case, that the patients will come with these symptoms. I am sitting in my cabin, patients came, I examined the patient, I found these symptoms, I sent him for investigation, he came back, I saw the reports, and I saw these findings, and now I am able to differentiate diagnosis. Then I asked some specific histories, and I wrote the treatment, what treatment I am writing, what dose I am writing, what is the schedule, what are the side effects I am concerning about, and try to visualize every case like that, every disease like that. That will integrate all of your subjects, and that will be easily remembered for your whole life, not for entrance exams only. That will be useful for during your case solving strategies during your hospital work too. So that is the one thing. Another thing I want to tell you is how to remember factual things. Factual things you have to revise repeatedly, like which mosquito do which disease, you have to revise repeatedly that. And how to revise, you don't have to plan schedule for that. Just whenever you have thought about the thing, do that on that point of time only. Don't postpone the thing. If you will postpone the thing, that thing will be postponed forever. You will not read for that thing. Means if I am thinking about some thing, and suddenly in my mind the word of Hodgkin's lymphoma come, then I will remember that Hodgkin's lymphoma. What was Hodgkin's? Okay, Hodgkin's lymphoma I remember superficially that it was lymphoma, and it has some classification of 4 types and all that. But in which types, which is positive for EBV, which has good prognosis, which has bad prognosis, what is the different things in that lymphomas, then clear that thing on that point of only whenever you will get thought. If you are reading physiology or pharmacology or medicine, if you will remember Hodgkin's lymphoma of your pathology, try to read at that time only, and don't search in the textbook. As I said, search in the Google Hodgkin's lymphoma directly. You will get hundreds of images of that 4 classification tables, and just read that tables in 5 to 10 minutes. Why that you will remember that things. Random reading is very useful. That will create active learning, and like if you are reading sequentially whole pathology, then many topics you will forget. But if you will read randomly one topic of pathology without reading surrounding things, that will create your brain actively. Means you will thought that okay, Hodgkin's lymphoma, what was there? You will try to remember the things. So that is very active learning, and try to read like that. Like if you are reading and one mosquito came around you murmuring in your ear, then what will you do? You will see that mosquito, and you will say that okay, which is this mosquito? If it's like simple fly, then you will remember what diseases are caused by fly. If it's by mosquito, then you will try to see. If it is like very flying thing, you can't focus on that mosquito, but try to see that it has any striations on the body, or it's sitting like which humpback or like that. If you can't able to see, then it's not at all worry. Just remember that okay, which mosquito caused which diseases. Culex causes this disease, Anopheles causes this disease, and if you can't remember, then instantly search on the net that different types of mosquito and different diseases. It will give you whole list of all the mosquitoes, Culex, Anopheles, sand fly, and any like domestic fly, and every diseases tables are there, and that revise that in 5 to 10 minutes. So by this type of frequent revisions, unplanned revisions, you can remember the factual things. That is the best method to remember factual things. Another question someone asked me is that should we remember all the factual things, or should we just remember the common things? So this is the questions which I want to answer is, you should try to remember every possible thing you can remember, because every time there are common topics in the exam, but there are new topics coming in every exams, and in that they are like keeping to ask some rare mutations, some rare antibodies, some rare genes and all of that. So you don't have to remember all things, but for that too you can use the feature of in Marrow they bold the important words. So just try to remember and focus on that important words. If you can't remember everything, that bold words are very very useful, and they are factual too, and they are high possibility to come in the future exams. Now another thing is as I told in my interview, is that examiners knows, every examiner who form the paper, they are forming the papers since so many years, so they knows that which are the common topics that students missed, and university important topics are same everywhere. So the examiners knows that these are being prepared by everyone, but these topics are left by everyone. So they will frame some questions for exams, so that they can differentiate every student from the topper. Topper read everything, so it will differentiate you, means every student from topper. So that are the things that you should not be missed. You should do all the possible things that you can, but not all the things, but at least the repeated topics which are not important for university, but they are being asked in the exams. In important topics too, why people, like many people said that we can rule out two options, but in other two options we got confused. Why? Because in that two options, while you are reading during your preparation, you missed that lines. One thing is the topic is important, but while reading in that question or that disease, we frequently, everybody does that unconsciously. Whatever things difficult to memorize, we just leave that. Like Hashimoto's thyroiditis has 3 antibodies: anti-thyroglobulin, anti-microsomal, and anti-peroxidase. Now during preparation, we just remember 1 or 2 antibodies. That okay, we have to write these 2 during the university and we will get enough marks. We can't load our brain with third antibody. We just leave that, and the examiners knows that this third antibody can be left by every students. So they will just put that third antibody as the option, and they will frame the questions that Hashimoto's thyroiditis have all antibody except. Now you know 2 antibodies. You will rule out 2 antibodies, but the third antibody, which is 1 is true and the 4th is wrong, you will get confused because you didn't read that third antibody, you didn't memorize that third antibody. So this is the thing that is like the behind the concept of forgetting or confusing between the 2 options. So how to deal with that? So while reading important and repeated topics, try to read as much as possible. Try to remember as much as possible. Not everything of Harrison. Just like if you are reading from Marrow or Prepared or MCQ books, they have only limited content for that particular disease. Try to remember that words, half page or 1 page of that particular disease. From that, if you will remember all words of that particular repeated topic, you will not be confused between many of questions. You will directly see that third 3 antibody you will remember, and you will directly tick mark with the 4th antibody. So this is the solution for that thing. Now I will cover separately all the sources which are being prepared by students. Like there are basically 3 sources, means not sources, 3 things you should do for your preparation. One is like video or coaching and making notes. Second is like solving MCQs from the qbank, and third is like giving tests. So now I will cover all these things separately, that how to do all of that and how to deal with that very accurately. First of all, let's start with the videos or coaching part. So one thing is, as I already said, that video or coaching both are same and you can do any of that. For videos, like if you are watching videos, then one thing is, should I watch all videos? No, it's absolutely not necessary to watch all the videos. If you are in 3rd year or final year, then I will recommend you to watch all the videos if possible. But in internship or in post-internship, it's not necessary to watch all the videos. Just watch the videos that you are weaker at or that you need to understand deeper. Other videos you don't need to watch, but in 2nd year, 3rd year, final year, you can watch all the videos of that particular subjects if you have time. Now, should I watch videos rapidly or just thoroughly, deeply, slowly? I recommend you should watch the videos rapidly, because compared to coaching, videos have more hours and they have more detailed things. Almost all things are like necessary things to crack the exams, but you should watch the videos in 1.5 or 2x speeds, because that is the necessary thing to save the time. Otherwise you can't complete even the videos. The MCQs and tests will be remaining pending. So try to watch videos in 1.5 or 2x speed, and if you can't able to run with that, then you can watch in 1x speed too. But if you have shortage of time, then watch selected videos at 1x speed. Now another thing I want to discuss is should I make notes from the video or not? Yes, you should make notes from the video. How to make notes? Now I think that you should make each word notes. Like whatever the faculty says, write it down in the notes, because every word of faculty is like one pearl. It's like a very jewel that will help you during cracking the exam, because the faculties are very experienced. They knows everything, that from where the questions are being asked and which topics are important, which lines are important, and they are telling you in the videos only that you should, because you should means write down that in the notes. So try to write down everything in the notes. Even teacher will tell you some joke or some entertaining things, try to write that too, because that will form correlation in your brain, that okay, teacher told me this joke, and because of that these things can be remembered easily. So you can write whole story if the teacher tells you story or some summary of the story or whatever, but try to write everything the teacher tells in the notes. While same for the coaching too. If you are going to coaching for Saturday, Sunday, then also you should try to write down everything in the notes. Now, how to make notes? Like usually, previously I made notes with just single pen, blue. But in final year I made notes of different 3 or 4 colors. And that is, I found somewhat effective, not too effective, but it's like beautiful. We will enjoy the reading if it is like in colorful notes or like that. So try to make notes in some 2 or 3 different color pens. In that you can put the subtitle with the blue pen, other things with like black pen or blue pen, and some important word with the red or blue pen or like that. Another thing is, someone asked me that should I make notes of all 19 subjects? Yes, you should make notes of all 19 subjects, because you have to revise all 19 subjects just before the exam, and notes are purely for the revision purpose only. You will clear some concepts from that, and you will know some important topics, but the main purpose of the notes is to make one single source that can be revised within 10 to 15 days of all 19 subjects. So you have to make notes of all 19 subjects. You can't leave any subjects like that. Then second part is question bank. How to solve question banks and MCQs. In that too you should be like very selective. If you have good amount of time, then you can solve all the modules. If you have very less time, then you should do only important topics modules, as I already said. See the important topics list and try to cover modules of that. Like in PSM epidemiology, biostat, then environment, mosquito, and that 4 to 5 topics are very important, and almost 70 to 80% questions will come from that topics only. So just do that modules if you have very less time, and if you have good time, then you can do other topics too. Now what to do for the remaining topics? Remaining topics, from that also 30% questions are being asked. So what to do, how to cover that topics if you are not doing from the modules. Then the third thing is like doing pulse. Pulse are in the Mero, which are freely available without any subscription. So the pulse will cover almost all possible things in the of that particular subjects. If you are not time to solve modules, then do the pulse, solve the modules of important topics, and do pulse of whole subjects. That will cover all important topics and non-important topics too. Doing pulse will cover all your subjects, but there is one loss, that you can't solve MCQs via that method, because in pulse there is only simple passive reading you have to do, and you have to memorize everything. So for remaining topics you can, but it's okay because they are non-important topics, not highly important. So you can do that simple memorizing without solving MCQs. So try to read pulse and qbank simultaneously. Now doing solving question bank, how to approach the questions. So one thing is, people confuse that should we read explanation of only wrong questions, or we should read explanation of true and wrong both. I would recommend that you should read explanation of all the questions, not only wrong questions, because in true questions also you can get the questions true by your memory or notes reading, but in the explanation you will find something new that is like integrated from different subjects, or like some new information related to that disease. So you have to read explanations of all the questions, whether it's true or wrong. Now people are asking me that should I add the new things in the notes or not. I will recommend that you should not add the things in the note, because that will take a lot of your time, and it's like in qbank it's very huge content compared to your notes. So if you will try to add in one by one in the notes, you will form another 10 notes of that subjects, 10 books of one subject, single subject, and that will lose the purpose of the notes that can be revised just before the 10 to 15 days. Notes are the things that are only one or two that books of one subject, so that it can be revised. If you will form 10 books of one subject and you will call that notes, then it's not the notes, it's like only some textbooks like material. So don't try to add everything in the notes. Yes, you can, if you can add something related material or like that in the notes, because if it will integrate your brain about the content. But if you will find something new, because in Marrow there are very new things. Many people are even asking me that I read the notes, still I am getting wrong in the question banks. Why? It's absolutely means normal. Don't worry about getting wrong in the qbank, because they have very challenging MCQs to experience and to guide you, to train your brain with active learning. So don't worry about the getting wrong, because notes will not cover everything. In qbank they have very large content compared to notes, so you will get wrong. Don't worry about that. But you will surely find new content during your MCQ solvings from the Marrow. So wherever you will find that new thing, you don't try to add in the notes, just bookmark that particular questions. Bookmark is the very good feature that will save your time, energy, and that is very smart work strategy. Because I used to do bookmarks, nobody told me to do like that. As I told you, I experienced the things on myself only directly. So I thought about adding the notes. Initially I added in notes too, but then I analyzed that it is wrong method, and it will cost me more time and energy. So then I started to do bookmarks. Now whenever I will get any new thing, I will just bookmark that. Within fraction of second, that thing is added in my bookmark session. Now that one or two notes and the bookmarks of that subjects are combined, we can call as one note that can be revised during 1 month before the exams. So bookmark are easy to revise, and while writing in your notes, your time will not be wasted, and within second you can do that, add that question in your second note, which is bookmark section. So that is the smart work strategy you should do. Now how to do bookmarks means we should bookmark every question or every things or like that. Now one thing I want to, if the question is totally new to you and you are very confused about that question, then bookmark that. Don't worry about getting note or bookmark or not like that. Second thing is, if the question is you know the questions, but there is one line in that explanation that is new to you. Now how to do that? So that particular line you can add in the note. You can't do bookmark of whole question just because of one line. Bookmark should be very selective, because you have to revise that before the day of the exam. So if you will find one or two line some concept or factual thing, then add it in the notes. Now if you will find some table, some chart, or some new thing that will take more time to add in the notes, then you can just bookmark, even if you know the questions. But there is one thing that you should see before the exams. There is some factual things, there is some tables, there is some signs which you tend to forget or which are difficult to remember. Then bookmark that, because that you should revise just before the day of the exam. So by that way you have to do bookmarks like this. Another thing is, should you do retrograde study? Many people ask me about that method. Retrograde study method means you will directly solve the MCQs without reading that topics from notes or any MCQ books. That's I think that is very, very effective method, because in that you have read that topic during your university or during your UG period. So you have some basic idea about that topic, and you are now directly started MCQ solving. So without reading particular things which are important for NEET from that topic. So that is good method. Why? Because in that method the chances of getting wrong are very high. And one thing is, people are afraid of getting wrong. That is the thing which separates topper from average students. Toppers are not being afraid of getting wrong. That is the most important thing you should learn, and you should practice yourself for that. Because it's very, very better to get wrong this time than getting wrong in the NEET or in the main exams. Why? Because if you will get wrong this time, it will cost you nothing. This is not real exams. But if you will get wrong this time, then that will create active memory. Wrong questions will be remembered forever, for your whole life. If you will get wrong and you will subsequently, instantly you will see the explanation, and you will like understand that, okay, why I got wrong, what I think and what this explanation explains. So by that method, the wrong questions will be remembered forever. So retrograde study method is good. If you can able to do, then I would recommend to do. But anterograde study method is also good. I did notes before and then solve the MCQs. That is also working. In retrograde study, you have guts to like deal with the depression or like getting wrongs. Because if you will get wrong and wrong and wrong, sometimes you will feel depressed. But that will benefit more than anterograde study. So both both methods are good. You can do whatever you will feel. Third part is giving grand tests. There are three or four types of tests: subject-wise test, mini test, micro test, grand test, all of that. Other tests are not at all important. You can give just you can give that if you have some time, or if you want to do after subject preparation. But try to give grand tests. Grand tests are very, very, very important things. Many people don't give grand tests, just they are afraid of, like, I didn't prepare all 90 subjects, how can I give 90 subject test? How? Nobody can prepare 19 subjects. Even before the day of the exam, nobody have all the knowledge or all the books in the mind of all 19 subjects. But still you have to give NEET without preparing 19 subjects. So why you are afraid of giving grand tests? Grand tests are very, very important. Why? Because they will adapt your body. Even if you will get rank or not or whatever, if you will get lowest possible rank, still it will benefit you, because you subsequently you will adapt your body for sitting 3.5 hours. Even first of all, you can't sit for 3.5 hours if you will give first 1 or 2 grand tests. After giving 2 or 3 grand tests, you will able to just sit, not concentrate, just sit for 3.5 hours continuously and reading the questions. And after 3 or 5 grand tests, subsequently your concentration and attention span will increase for whole 3.5 hour duration. And that is most important thing for cracking any exams. Your concentration should be as high as on like starting of the exam up to the end of the exam. Even you can't decrease your concentration for 5 to 10 minutes during the day of the exam, because that will cost you 10 to 15 MCQs. And how you can concentrate? By practicing grand test as much as possible. Whatever rank you may get, but your body, your brain will be adapted for that 3.5 hours, and that will benefit you directly during the main exam. Even if you read nothing or prepared nothing for specifically any exam. So that's the thing that you should do. Why are you afraid? Who will know your results? The results of grand test will be shown to you only. You will see the results, you will analyze the situation, and you will try to improve after the results. Grand test ranks, even if you are getting lower ranks in the grand test, then it's good, because that you will see your level, that where are you and how up to where you have to be in the future, and what type of strategies now you have to apply. Like you read for 2 months and still you are not getting good rank, then you will again analyze the situation and you will change your strategy, change your modifications. But if you didn't give grand test, then how can you know that you are preparing means effectively, your strategy is good or not, or any modification needed or not, like that. If you will give grand test, then only you can analyze that, okay, I prepared by this strategy, but it is not improving my work, so I should plan another strategy now. So that will be whatever rank you will get in grand test, but these are the extra benefits of giving grand test, not only the rank improving and all that. Now another thing is when to start giving grant tests. Basically I gave my first grant test in the final year ending, and I got around 12,000 rank in that. But I suggest you that while you are in the final year, just give 1 or 2 grant tests in the final year and just analyze your basic knowledge, that from 300 how many questions or how many rank you get. And while starting of the internship, you should start seriously giving grant test. Whatever subjects you will read, 3 or 4 or whatever subjects you will read, just give the grant test when it is live. Don't postpone the grant test that I will complete this subject in 4 days and then I will give grant test, I will get predicted rank. But no, if you will postpone the grant test, you will not give it at all. I postponed 2 or 3 grant tests during my internship and they are still pending in my account. So if you want to give grant test, give it whenever it came live. Whatever subjects you have remaining, whatever subjects you have cleared, anything, just give grant test when it's live. Try to give grant test on the last day of the live session. Like if it is live for 4 days, then give it on the 4th day. Because if you will give one in 1 or 2 or 3 days and you will get some low score, they will give you score, not rank. Rank will become after only 5th day. But the score will be given to you on the completing of the exam itself. So if you will get low score, then you will be like somewhat depressed, or you can't find energy to read more for up to your ranks will come for 2 or 3 days. Instead you will give on the 4th day. Next, most probably your only 1 day will be wasted if you get low score or if you don't want to read. But after giving grant test, people usually don't want to read for 1 or 2 days. So that will waste your 1 day only. But if you will do on the first day, then up to rank coming after 4 days, up to 4 days you want comfortable to read easily. So try to give grant test on the last day. And on the starting of the internship, I suggest you to give 1 grant test each month for first 6 to 7 months, then 2 grant tests per month for next 2 to 3 months, and 3 to 4 grant tests in next 2 months. 3 to 4 grant tests per month for next 2 months. How to analyze the grant test results? Grant tests, one thing is, if you are preparing very good, then your grant test rank should be improved. You should see ranks. Mark my word, ranks, not score. Because score will be varied depending on the difficulty of the level. Sometimes you will get top 100 rank with 600 score, and sometimes you will get even 2000 rank at 600 score. So score, and you will see that okay, I got 600 score and it's good, I will crack NEET. But that's not true, because your rank is decreasing. So try to analyze ranks, not score. Your rank should be improved in each subsequent grant test. When I gave my first grant test, I have 12,000 rank. Then subsequently my ranks, every time my ranks improved. In the second month I got 10,000, then 5,000, then 3,000, then 2,000, then 1,000, and within last 2 months I was amongst under 200 in all mock test and all grant test, and in NEET also I got all India rank 186. Then I started preparing again, and again for AIIMS I got 15 and second, means in one I got 15 and in one I got second rank in grant test. In AIIMS I got 76. After that I gave Jipmer, I got second rank. Every time my ranks improved during giving grant test. And that is if you are preparing seriously and if you are analyzing the situation, modifying your preparation, and you are very stick to your preparation, then your rank will definitely improve. Don't worry about that. Just prepare and left remaining things on God. If you are working, then God will give you everything. God is sitting in ahead of us, and they are analyzing all the situations, who is preparing hard, who is preparing less. They will give you, the person who is preparing hard, they will give the results. The person who is not preparing, they will not give anything. That is the rule. If you are working, then you will get the results. So just work passionately towards your goal, and you will subsequently get your ranks or whatever improvement you need. So try to analyze and see that your ranks are improving or not. If not improving, Then again analyze the situations, that what you read in the last 3 or 4 months or 3 or 4 subjects, and how did you read that. If it's like strategy modification needed, then do that. If you know that okay, I got factual things wrong, or I have less concept cleared in that subjects because of rapid schedule or whatever, then analyze that and try to not making that mistakes in next subjects. In grand test, you will tend to forget the subjects which you read before 3 or 4 months. Like you are giving grand test in the 7th month, then you won't remember the things of 2nd or 3rd month subjects. But still, you will get around 40 to 50% correct in that subjects, and that is absolutely normal. Everybody tend to forget after 4 to 5 months reading. Just don't worry about that. Even I tend to forget about that things. But I got correct around 40 to 50% in that subjects, because the basic knowledge of my UG period and that first time reading was there in my mind. Some options I can rule out, some options are like direct one-liners that I can be able to do right. So that will be wrong. But in the last month, you have read that 3 or 4 subjects. In that 3 or 4 subjects, your score should be around 70 to 80%, because you read that recently. So your score should be good in that subjects. If your score is not good, then you did mistakes, and you have to analyze where did your mistakes. See the wrong questions of that subjects and analyze that you got factual things wrong, or conceptual things wrong, or you got confused between the things, or you didn't read that thing before, and like that. So that you know that okay, I did that topic rapidly, and that should not be do again in next subjects. So that is the thing you should follow while analyzing the grand test results. Now the question is what scores or ranks increase is called as improvement. So that's variable, depends on your level. If you are getting 100 marks or 50,000 rank today, then you should do improvement giving after each grand test. Your improvement should be around 100 to 150 marks and around 10,000 rank. If your rank is within 1000 and you are getting 600 to 700 marks, then around 10 to 50 marks improvement is also quite good. So that will depends on your level, but you should try to improve maximum ranks and maximum marks as you can in each subsequent grand tests. Another thing is some students ask me that should we give grand test in laptop or mobile. See, this is the it's not at all matter. You can give your grand test in your mobile or laptop, but it's better if you have laptop and you can give it in laptop, because that will feel like some computer based test, and in NEET there is computer in front of you. So it will be better if you have laptop. I don't have any laptop, so I used to give grand tests via mobiles only, but still it worked. So if you have laptop, then give it in laptop. If you have not laptop, then mobile will be absolutely normal. Don't worry about the device you used for grand tests. Now you have given the grand test, the results came, you saw your rank. Now what's the post grand test strategy? One thing is to analyze your grand test performance and to modify preparation according to that. But how to analyze your grand test performance? See, you should not give too much time in solving grand test, because grand test have 300 MCQs and each MCQ has long explanations. So if you will solve all the explanations, then it will take you 2 to 3 days and you will break your routine schedule. So don't try to solve whole grand tests. Just first of all see the wrong questions. You have to give 6 to 8 hours after grand test results to solve, means one day. In the morning the results will come, then give one day of that day for the analyzing the grand tests and solving the MCQs of that. So first of all see the wrong questions. If you are if you have very high wrong ratio, then it's like some danger sign. You should be worry about that and analyze the situation. First of all, subsequently see one by one wrong questions. Analyze that why you get that question wrong. What did you think while solving or answering that question, and what is the actual reason of the true answer. So see that why did you get wrong. if it was factual question and you have confused about that and you didn't remember the factual things of that subjects, then like you are weaker at memorizing the factual thing, or you didn't memorize that particular memorizing thing. So now modify your preparation during next subjects to focus more on the factual things. If your concepts are wrong, like some questions are conceptual, still you got wrong, then again see that you thought right or not. If you are right, then why you got confused between two and what is the actual answer. Then if you are like somewhat lower for that, then again you have to understand that you have to clear thoroughly concepts during next subjects. Now after doing these things, again just see the true question. You have see all the wrong questions within 2 to 3 hours or 3 to 4 hours. Now after that, just see the true questions, like read the MCQ and see the true option you ticked. And if you find that okay, you thought that and it's right and because of that it's true, then it's absolutely normal. Just superficially do the explanation, read the explanation and give, because you know already that MCQ, so you don't have to spend time for reading whole explanations. After if you find some MCQs that are true but it was purely based on your guess or like by luck you got it right, so that MCQ you should do whole explanation, because that is like wrong question only, you didn't know about that questions. So that guess or by luck right questions you should revise, and you should understand the explanation that why this question was like that and why the option was like that. So that is the post grant test strategy. Analyze the all subject wise test. Today online platforms has very huge application, very like what we can call it standard application, which cover all the necessary points for analysis, like peer performance, toppers performance, subject wise performance, percentile, everything they will cover. So if your percentile will be above 90, then it's good in each subject and in whole grant test. If your percentile is below 90, then that subject should be focused upon more during revision. And if he like subject wise test, also analyze the ratio, like from 8 questions what questions you will get correct. But instead of ratio, the percentile will be more effective for analyzing, because sometimes you will get 8 out of 10 correct and your percentile will be like 80, and sometimes you will get 3 out of 8 correct but still your percentile will be 95, because that was difficult subject questions. So it depends on subject questions difficulty. Questions will be difficult, then everybody will have low score, and if the questions are easy, then everybody have high score. So check the percentiles, not pure score of like 50% or 60% correct like that.